Good morning and welcome. I'm Charles Chima, Public Health Director for the City of Sioux Falls. Really pleased to welcome everyone this morning for this press briefing. I have here with me Paul Hanson, our CEO, President of Sanford Sioux Falls, Dr. Donajak, who is the Acting Chief of Staff, Sanford, Sioux Falls, the VA Healthcare System, Dr. Mike Elliott, the Chief Medical Officer, Vera McKinnon Hospital. So today we're presenting the new Community Health Assessment Report for Sioux Falls, which, as some of you might know, we had this collaboration between the health department and the two major health systems here in the city over the past decade, where we work together to jointly assess health in our community. And we're pleased in this round, this latest report, which is the third time we're doing this. We do this about every 3 years, to add a new partner to the core group, which is the VA healthcare system. So really pleased to have the VA join us in this collaboration. It shows, the most important word you hear today is collaboration, right, which is really how we come together as the major health and healthcare players in the community to see what we can do to collectively understand the factors that are driving health in our community. But also, something new that you hear today is not just telling you what the issues are and what the challenges are, but the opportunities, the roadmap we're building together, which we'll call the Community Health Improvement Plan. So we go from talking about the Community Health Assessment, to the CHA, to the Community Health Improvement Plan, which is really the opportunity we have to work together with, including the non-health partners like the school district, 211, and other community organizations, to really see how we can move from where we are today to a state of better health in our community. Over the past, so I will invite our partners here today to just kind of say a few words of remarks, and then we go ahead and get started with the presentation. Thank you.
Thank you. Well, good morning. All right. My name is Paul Hanson, again, and I am the president of Sanford Health here in Sioux Falls. We've been here before, right? We've had the opportunity to talk about our community needs assessment. We've talked about it in the past, and the importance of being able to set aside our competitive nature in some of our business operations to do something that's right by the community. And I think that, again, our community has demonstrated that we can do that we can set aside those differences and we can partner to do something that's right for everyone. And this needs assessment, as it has been done in the past, provides us a valuable roadmap for us to be able to make investments in our community and go beyond perhaps what we would do if we did not have this assessment in place. So on behalf of Sanford Health, and on behalf of the relationships that we have with the city, the county, the VA, and Avera, we are pleased to be a partner in moving forward with this and thank everyone for their involvement. So with that, I'll turn it over to you.
Good morning. This is really an exciting time for us too. I'm Dr. Donna Jark. I am the Acting Chief of Staff presently at the Sioux Falls VA. And on behalf of the Sioux Falls VA, we are excited to be here today in collaboration with all our healthcare partners and being an active part of this process and project. The health assessment showed that the community is impacted by preventable differences. I mean, in varied life expectancy, quality of life, health outcomes, and access to opportunities. So the partnerships that we've gained and want to continue to engage in through the process, we want to optimize health care and well-being for our community. So the VA, as I am representing, is great and is excited to be part of this project and process. Thank you.
Good morning, folks. As Dr. Chima said, I'm Mike Elliott. I'm honored to serve as the Chief Medical Officer for Vera McKinnon Hospital. The collaboration is, I guess the best word for it's inspirational. We learned a lot through COVID. I know I shouldn't say that word, but we learned a lot. And truly honored to work with the city health directors, with my partners at Sanford and the VA. Let's face it, we're a lot better together. I'm reminded of the phrase that when I becomes we, even illness becomes wellness. And I think that's a great concept as we move forward. Our community's growing. Projections are we're going to be at 500,000 people in the four-county area by 2040. And although 2040 might seem like a long way off, I tell you it's going to get here fast. How can we be proactive in identifying what the community's needs are and getting ahead of them, being the best community, the healthiest community that we can be? And a lot of that is due to the collaboration with these great folks. So again, Avera McKinnon is proud to be a partner in all of this, and proud to think about what can we do to provide great health care, but also set the community up to be as healthy as it can possibly be. With that, I'll turn it back to Dr. Chima.
I can't say thank you enough to our partners for being here today. Your leadership has really made this possible, and the expertise that your respective teams have brought to this process has just been incredible to work with each and every one of you. It's, we don't know how well and how good we have it in our community to be able to have the big players really work together and put the community first. So it's a really wonderful thing and a beautiful thing to watch and experience and be part of. So it's a big privilege and an honor to work with all of you. So today, we will kind of give you an overview. So we do this roughly about every 3 years, right? So it's important to put things in context with regards to how things are changing and the direction that health factors are trending. In doing this assessment, and this is a really thorough, this is not just a single survey or a one-time study. That is a comprehensive process that starts by looking at existing data. So, routine surveillance data, data from national surveys that are able to tell us some of the things happening locally, but also we design specific studies, we do focus groups, we do interviews, we do a resident survey where we identify a sample of the population and the partners send out the survey, and we collect all this data and try to triangulate these different sources of information to get a picture of how things are changing in our community. A few things that you might hear about today are some of the highlights with regards to where things are trending from since the last report. One big theme you're going to hear about is chronic disease and injuries. In many ways, these are kind of some of the high-level issues we should pay attention to, whether you're talking about diabetes or high blood pressure or obesity, right? You see that we're seeing changes continuing to trend in a negative direction. More recently, we're seeing an increase in sexually transmitted infections in our community, syphilis, gonorrhea, and the likes of that. Again, this is another high point that is detailed in this report, and we'll talk more about the report and where you can find the report to get into some of those details. We'll also find that this has been a constant theme across all the assessments we've done, right? We know both from the concern that residents have as well as what the health indicators tell us that mental health and substance use continue to be a big challenge in our community. Yesterday, we had an update on the Link, which is a project that, again, the major partners here in the room have worked together on. And that's one of the ways that we are working as a community to address some of the burden of mental health and substance use. But they continue to be one of the key issues that we'll deal with. And even more specifically, so we did not only just look at health outcomes. And by health outcomes, I mean the status of health, so how long people are living, the quality of life that our community members have, but also the diseases that that our community members are burdened with. So that's what we mean by health outcomes. And then we take a step back and ask questions about what are some of the drivers that are responsible for these health outcomes that we see. So we look at whether it's health behaviors, whether it's issues in the social environment, whether it's about access to healthcare, and all the things that play a role in determining the health of our community. So some of the things you hear about again today about how we continue to have a challenge with substance use, particularly alcohol use in our community. And more recently, even though we've seen declines in the past, we're beginning to see an uptick again in tobacco use. So with that, I will invite Shelby. Shelby Colmes is the Public Health Prevention Coordinator for the Health Department. And so she will give us a few more data points to kind of illustrate some of the high-level issues that we're seeing in our community. Shelby?
Thank you, Dr. Chima. Over the past year, we examined many different health indicators, and all of that is available in our 154-page report, highlighting the health behaviors and health outcomes in our community. But today, we will give you a snapshot of some of those data points that informed the next steps that we will take as a partnership. Upon reviewing the data collected during the community health assessment, a number of significant concerns were noted and grouped into the following categories: a high burden of chronic disease, mental health disorders and injuries, poor oral health, especially in children, health disparities, and COVID-19, other communicable diseases, and other issues. Health outcome measures give us an overview of the health status of our community. Health outcome measures give us an overview of the health status of the community by looking at length of life, quality of life, and the presence and impact of disease. The high burden of chronic disease, mental health disorders, and injuries are cause of concern in our community. They impact not only how long we live, but also our quality of life while we are living. Unfortunately, data from our CHA shows that in many areas, the health outcomes of our community are trending negatively. Intentional and unintentional injuries are leading cause of death in Americans, and in Minnehaha County exceeds the national average. One of the top causes of unintentional injury death in the MSA is poisoning. Unintentional poisoning can be a result of a number of different substances, but leading poisonings in the MSA is drug use. Data found in the CHA shows that the unintentional rate of poisoning deaths is rising and currently at 14.7 deaths per 100,000 population. In addition to poisoning, motor vehicle crashes are also leading cause of injury deaths. The National Safety Council notes that the top 3 causes of fatalities on the road are speeding, lack of seatbelt use, and a particularly troubling statistic in the MSA is alcohol involvement. Of driving deaths in the MSA, 28% involved alcohol, significantly higher than the national benchmark of 11%. Furthermore, falls can result in injury and death for individuals of all ages, and unfortunately, the unintentional fall death rate in Minnehaha County is alarming. For adults 45 and older, falls result in 55.2 deaths per 100,000 population, just over 2 times the national average. Health determinants are the underlying factors that are driving and contributing to observed health outcomes. These factors are also key when developing and implementing programs and policies to improve health. These health determinants include behavioral factors such as high rates of alcohol, tobacco, and other substances, low levels of physical activity, and unhealthy dietary behaviors. Environmental factors include barriers to healthy eating and active transportation, poor transit network, infrastructure, and air and water quality. Socioeconomic factors such as food insecurity, limited affordable housing, poverty, or gaps in digital access, as well as inadequate access to and quality of healthcare services, limited supply of dental and mental health providers, health insurance coverage gaps, rising cost of care, and an inadequate use of preventive services. No one factor dictates the overall health of an individual or the community, but a combination of these factors and behaviors is key in preventing and managing chronic disease. Health behaviors include diet and exercise, substance use, tobacco use, and sexual activity. Unfortunately, as a community, we fall short of what is recommended. For example, on average, 39.8% of adults eat less than 1 fruit per day, and 17.7% eat vegetables less than 1 time per day. An additional 25.8% of adults do not participate in any physical activity outside of their working hours, and a third of adults do not meet recommendations at all. Alcohol and substance use will remain an important part of public health topics, both here and communities across the country. Binge drinking, or the number of times respondents consumed 4 or 5 alcoholic beverages per occasion in the past 30 days, has continued to rise. 21.4% of adults have responded binge drinking. This has been an area of concern both in our community through the last 3 reports. But since the last report, we have seen exacerbated mental health and substance use issues due to the pandemic. Whether we are talking about alcohol or other substance use, there is an impact not only to the individual, but community, employers, and families as well. It is important to note that while it is important for individuals to make healthy decisions, not everyone has the means or opportunity. Socioeconomic and environmental factors influence our ability to be healthy and make healthy decisions. For example, even with the many healthcare assets that we have in our community, residents identified access to care as an area of need. It is important to note that access can mean something different from one resident to the next. In general, access includes the ability to understand what health resources are available in the community, gain entrance into the healthcare system at a location where their services are needed, to find a trusted healthcare provider, and to have the ability to pay for those services. Just under 10% of adults in our community lack health insurance coverage, and 21.4% have not identified a primary provider. Access also extends beyond healthcare services. The physical environment and our ability to access food, especially healthy food, is important to our health. There are geographic areas within Sioux Falls community that residents do not have easily accessible options. Unfortunately, the number of areas that we are seeing in our community is continuing to rise, and we now have 8 census tracts designated as low-income, low-access priority areas, 2 more since the 2019 assessment. Roughly 30,000 individuals live in this area in our community. And unfortunately, disparities exist when it comes to environment and access, including geography, age, gender, race, ethnicity, income, and education level. I only touched on a few data points in this report, and it's hard to say that one is any more important than the other. And in the same way, no single entity can address these issues alone, but a community can. That is why this year we are decided to launch our first ever community health improvement plan, a plan designed to spark community-wide effort to improve the health of our residents. After preliminary data was gathered and available through efforts of the CHA, partners convened earlier this year to review data and develop 5 priority areas and goals that address the health issues that we are seeing here in our community. These areas were prioritized out of many findings in the CHA with consideration to factors such as urgency, scope of the issue, economic feasibility, potential for impact, availability of community assets and resources, and value to the community. The 5 priority areas and goals for the 2022-2025 CHIP include active living, or getting people to move more, healthy eating, increasing consumption of healthy foods, mental health and substance use, to reduce the deaths due to intentional and unintentional injuries, oral health, to improve oral health through the reduction of dental diseases, and preventive care, increasing the utilization of preventive care services. Subsequent meetings prompted discussions on strategies and activities that will drive progress towards these goals. And while discussions will be ongoing and work in this priority area has already begun, for example, based on findings regarding food security and food access, the City of Sioux Falls recently launched the Eat Well Sioux Falls grant program to help increase access to healthy foods for the residents who live in food access priority areas. We are proud of the partners who have taken lead and ownership over this community plan and look forward to continuing to engage more community members and organizations to implement and evaluate the CHIP. The word partners has been used extensively today, and because truly, the work we are doing couldn't be done without them. I will invite Dr. Chima up for final remarks.
Thank you, Shelby. As you know, we can't emphasize the word collaboration enough today, right? And collaboration not just in working together to produce this 150 plus page document, but in really working together to identify and recognize that we are one community. And you know, I couldn't have said it better than Dr. Elliott said, right? Is how do we get from I to we, right? So that we can have that focus on wellness, and how do we not just look at this data and say, oh, it's all gloomy, right? Why are things getting worse? We're having more people use alcohol. We're having more deaths from opioid use and other challenges in our community. But how do we move beyond those concerns to looking at from a positive point of view? It's what are the opportunities that exist for us to work together? And so it's been wonderful to be part of several meetings involving these partners, but also, like I said before, the school district, 211, too many partners to mention. Our partners at USD, including the Center for Rural Health, our partners at SDSU, the Department of Population Health, and each and every organization that has participated in this Community Health Improvement Planning Policy, including so many city departments, the Police Department, Planning and Development Services, Public Works, that have all come together to say we need to approach this as one. So it is important that we keep that collaboration moving forward, and I invite everyone to take time. There are just too many data points for us to go through at this press conference. So it bets that we've created this webpage on the city website where you can always go and you find this report. So when you get to siouxfalls.org/community-health, you'll find the community health assessment, you find the community health improvement plan, but you also find a link to the grant program that Shelby mentioned earlier. Because this time around, we really want to have that focus on what are we going to do about these issues and how can we improve health in our community. So that's just one example of ways that we can use our resources to work together to improve health. So we invite partners to once again pay attention to that grant opportunity. If you are in the retail space, if you are working in food access, whether as a nonprofit or a private entity, let's use those funding resources to make use of, to work together so that we can improve food access in our community. We really, again, just want to thank everyone for coming today. And after the press conference, happy to, take questions as applicable to the various partners. I'm happy to address all the questions that you might have. So thank you for coming today, and please continue to engage with us as we work through these initiatives in the next 3 years. Thank you.